I'm always surprised that so many people have heard of ChatGPT and other AI platforms, but there's still a lot of people that haven't tried it yet. So they really don't know what the experience is like, and maybe they're not really familiar or clear about it. Hi, I'm Harlan Krumholz from the Yale School of Medicine, and I just wanted to take a few minutes to talk about these new models and to provide a little context in case you're one of those who hasn't had a chance to really try them out yet. So these AI models like ChatGPT, they're called large language models. Sometimes people hear people offhand saying LLMs, large language models. Makes you sound like you're in the know if you say that. Well, these are foundation models that are trained on massive, diverse, large data sets and can be applied for numerous downstream tasks. For medicine, these can be used as chatbots for patients. What are chatbots? Chatbots are sort of automated tools that can interact with patients to elicit information and even give advice without the need for a human being involved. They can be used for interactive note-taking, or they can augment the performance of people doing procedures. They can generate reports like radiology reports. They're helping basic scientists identify targets for drug development. They can be used for bedside decision support. Sound too good to be true? Well, at least at this stage, it is a bit too good to be true. I mean, it's a remarkable tool. I think we're at a juncture in history. I mean, it's a step function with what these are able to achieve compared with what I was seeing was able to be achieved with AI before this. Now, this is about taking unstructured data, not data that fits into like a case report form or into a given field, but take unstructured data like notes and text and be able to make sense of it and then be able to feed it back appropriately when people are asking questions. Now, you may know that there are a lot of people who are raising warnings about this AI. They're thinking that we're moving too fast, that there are even some people who think this could be the end of humanity. Now, lest you think that this is only about people who are untethered to the reality of the world, this is actually very smart people, very well steeped in AI, are expressing concerns, and governments are stepping forward and wondering who should really be able to control this kind of tools and how might they be applied. There's another feature to these. Well, let me say it's both a feature and a bug. That is, these models are capable of creativity. So you could say, I want to write a note to someone and I want it to be done in the form of a Shakespearean sonnet. Well, it can actually produce that, or in the style of anyone that you can think of. That's creativity. But every once in a while, you'll be asking it a question about reality. And believe it or not, these are called hallucinations of the AI. That is, it can provide an answer that may even seem reasonable, but actually it's made up. It's made up. This happened to a lawyer who was using it to develop references for a court case. And it turned out that some of the references were actually made up references, quite to the embarrassment of the individual and perhaps just some professional harm. So there's a lot to sort out with these, and it's a range of possibilities. Like I said, it's a juncture in history, but I urge you to give it a try. I mean, for example, in clinic this weekend, I do a clinic with medical students, and we were taking some of the more perplexing patients and putting their symptoms into this. By the way, you just put in, I have a patient, these symptoms. You want to be careful, by the way, this isn't mostly HIPAA overseen, so we were being vague, but still put in the symptoms. It generated a pretty good differential diagnosis. And so this can be used for a wide variety of teaching, but you do need some expertise to know whether or not what it's giving you is real and whether you can trust it and rely on it. So a recent New York Times article came out, and I was quoted as saying, you'd be crazy not to try this. And I'll say this too, I really urge clinicians, healthcare professionals to become familiar with this kind of technology. Give it a try, take it for a ride, get familiar with what's coming out, because I think on the horizon, you're going to see this in medicine. You're going to see this being applied in a wide variety of ways. You're already seeing Epic making an agreement with Microsoft and OpenAI, who developed this platform, ChatGPT, to be able to integrate it into Epic for many of the tedious tasks that need to be done, report generation and so forth, that could actually make the lives better for physicians and make the chart more complete. Now, we talk a lot about ChatGPT, but just by the way, there are a lot of these large language models out there. ChatGPT is just one of them. And many people are suggesting that future generations, these are only going to get more powerful, and there will be competition among the tech companies and others, newly emerging companies, that are going to try to leverage the rapid advances. And in the last 6 months, again, by the way, people have said that there's been more advance in the field of AI than they'd seen in a decade. And so I think we're on the cusp of a different moment in history. This issue in medicine is going to be very important. And also, what needs to be regulated? What is it that can come into medicine that doesn't need to be regulated? And what can we really trust? As clinicians, we don't really need to understand exactly how it works, but we need to know whether we can trust it. And that's going to take some additional time. Testing, we're not quite sure how it's going to fit, but I'm sure in the end, this will help transform medicine, hopefully for the betterment of patients. We need to be involved to ensure that there's not unintended harm that occurs as new technology gets introduced. But I'm optimistic about the possibilities. And again, I urge you to give them a try.